Zero discrimination is a big issue, is a big topic for us in UNAIDS because in order to get to zero HIV new infections or zero AIDS-related death, stigma and discrimination is a big barrier in order for people to reach services. So for us, zero discrimination is a goal that we hope to be able to achieve, and it's also a condition. In order to achieve ending AIDS, we must achieve zero discrimination. Discrimination, is something that is very heavy. So when you're faced with discrimination for whatever reasons, it could be, as who you are, or the color of your skin, or your HIV status, or I like to say, like, my white hair, for example. You can be treated differently and you're discriminated against. When it matters the most and when it is really detrimental is when it interferes with services that you might be able to access. So you might not be able to apply or bring your children to school. You might not be able to keep your job because you're discriminated against, because you're different, or you have HIV, for instance. And the same as when you want to go and seek health services. We're already very afraid to go see a doctor, right? It will be even worse when you fear that you're going to be judged for being different, or even self-perceived differences. So that is why it is very serious that if people face stigma, they also most likely fear that they will be treated differently and they will not seek health services.
Of course, the Office of the High Commissioner for Human Rights, we are the leading entity within the UN on human rights, and our work is really dedicated to promotion and protection of all human rights everywhere and for everyone. Discrimination is key to prevention and social cohesion. As I said, it's a prerequisite for all other rights. Without it, for example, right to health fails. Freedom of religion or belief, education, and political participation become hollow. As my High Commissioner has emphasized, equality and non-discrimination are about empathy, solidarity, and building societies where everyone can live with dignity.
Well, non-discrimination, of course, in providing healthcare services is very essential, no? Especially this ensures individuals, regardless of your age, your gender, your disability, race, religion, status in life, or even your sexual orientation. This provides proper diagnosis and adequate treatment to be given to patients. Well, stigma significantly reduces the willingness of individuals to seek early medical care. So this results in delayed diagnosis and, of course, poorer health outcomes. No? So there are two types of stigma. No? There is this self-stigma and, of course, the public stigma. No? So this causes psychological barriers in accessing proper medical care. Well, the UN clinics, they follow strict international health standards and ethical guidelines to maintain the confidentiality, dignity, and non-discriminatory care for our patients. No? The UN clinics, they also implemented the electronic medical record system, wherein there is data protection for all our medical records. And at the same time, we provide physical privacy environment in conducting our consultation, examinations, and treatments of our patients.
The Common Services Unit basically starts with providing a conducive work environment for all the interagencies to work together as one UN. And in doing so, we engage a lot of outsourced service providers. We make sure our team, they are all inclusive. There are no barriers, no discrimination of any sort in terms of race, gender, religion, and we have all of them mixed from all parts. They are basically Nigerians because we have females, males, and security guards and cleaners in all aspects of our services. We have zero tolerance for that within the UN. We give them training at all times. Our workers, our team, we do trainings. Part of the trainings we do all the time is to remind them of our zero tolerance for discrimination of any form, whether in terms of race, color, ethnicity, religion, gender, and even physical ability or disability. We have zero tolerance for any form of discrimination. We encourage them to also be ambassadors to help us to influence their various private spaces.
I assign meeting room, and when there are events, I don't really give meeting rooms to a particular set of people. I don't consider I give room to anybody, both the housekeepers, gardeners, anybody, people living with disability. The improvement I've seen so far for people living with disability, they've included ramp, there's elevator, so there are a lot of infrastructures in place. Leave no one behind, everyone is equal.
First of all, what you notice is that the individual, from a subjective point of view, the individual begins to feel unseen, okay, as if he or she does not exist, because there's isolation that comes with it. When you discriminate people, you isolate them. It's a way of telling someone that you don't belong, so you stay there, we against you. And that's where the mental illness actually starts from. And these are depression and anxiety. The individual becomes depressed. Why? Because situation becomes hopeless for the individual. First, the individual has to reclaim, the narrative. Show other people that you cannot be discriminated against. That's first. And then, as colleagues, we need to also come and support one another. We have duty of care. When we notice that a colleague is not feeling too well or not behaving too good, contrary to what we know that colleague to be before, there's need for us to approach or engage the colleague and ask the colleague, how are you doing? Simple, open-ended questions like that can open up, the colleague's mind, and a conversation can start. And that will gradually begin to bring the colleague back to the fold. I want to tell staff, simple and easy, that nobody can discriminate you except you discriminate yourself. So it starts from you.
Feel on top when people appreciate the work I do, increase my morale, productivity, and it gives me more confidence and courage to do better than what. Discrimination affects community in so many ways. One, it brings inequality. Two, it brings corruption. Zero discrimination, to me personally, it means we should treat everybody equally, be it male or female, be it small or big, be it man or woman. Everybody should be treated equally in the society.
I think the very first thing is that you speak against it. You come out against very strongly, come out against any form of stigma or discrimination whenever it manifests. So you come out clearly against it and ensure that people who are stigmatized or discriminated against, they have some form of redress. And so they feel welcome, they feel included. Another way is also to look at if there are policies, if there are laws that promote or in any way encourage stigmatization or discrimination. You try as much as possible to address such policies. Community leadership is very critical in terms of even driving interventions, driving policies, driving programs, and also getting people together and showing examples. So community leaders permeate all forms of action that you need to take to address any form of stigma, any form of exclusion.
Equality in my line of business means a lot. Everybody, especially as in the UN family, everybody is one. Give equal treatment to whoever comes into the UN compound, being you visitors, being you contractor, being you a staff member who have a legitimate ground pass. Everybody is treated equally.
Discrimination affects the community because it's the one majorly bring the violence, bring war, it brings enmity, and then it can lead to misunderstanding and cause a lot of damages.
Yeah, my work just supports equality and human rights by ensuring that it promotes the rights of persons with disability. I also ensure that our programs, our projects are also inclusive, irrespective of your gender, irrespective of your disability. We are very, very much inclusive in our programs. Over the years, I think we've made some progress in terms of accessibility. In the UN system, for instance, our venue, our building is accessible to persons with disability. And to a very large extent, there's been more awareness about the rights of persons with disability. And disability issues now has tilted from being a charity model to a human rights model. So disability now is seen more like a human right. So we don't actually discriminate irrespective of disability or gender.
I feel equal treatment is actually something that is inherent for everyone. It's a basic right for you to be treated equally, no matter your status, no matter your skin color, no matter your race. You should be treated equally.
I like it when they smile, when they're coming very happy. For me, I think their smile alone just brightens my day. It also makes me smile.
Yes, I felt value for UNDP, all the UN house. Everyone value me, value security, value cleaner. I'm treating fair, treating good in UN house.
Important to acknowledge the fact that access to healthcare services is key. And then number two, looking at legal protection. I'm talking in the sense that it is important to put frameworks and acts that protect people rather than creating legal barriers that hindered people or that criminalize people, which eventually limit them from having access to treatment. So these are some of the things I think when we look into those things, we are really pushing forward to ensure that discrimination-free community is possible.
I think the message is clear. We are almost there. We are very close to our goal of ending AIDS as a public health threat. The government and civil society and community and everyone that is concerned about HIV and ending AIDS, we have this last mile to go. And I think it is crucial now that we all work together and that we do everything that we can to get there. And a big part of that is to ensure that we're all equal, that we support each other, we're kind to each other, and that we don't perpetuate any stigma and discrimination moving forward.
My hope is that we all put human rights at the heart of everything we do. That we unite in solidarity with everyone everywhere, not just in our community, just not those who look like us or believe in the things we believe in, but solidarity with everyone.
Well, as medical professionals, we need to be reminded that we are bounded by the Hippocratic Oath, the principles of the Hippocratic Oath, which mainly has two basic principles, which is to do no harm to our patients and at the same time to keep our patients' best interests, especially in protecting their rights.
Just like the UN slogan of "Leave no one behind," I want to encourage everyone to realize that we are all one person. There is no difference. We are humanity. There is no other race. We are the human race. And so once we begin to recognize that we all have our individual contributions, we do things in a more inclusive manner. And that, at the end of the day, you find out you get more better results.
A very good message and a very strong one to the public is that everybody should have an equal treatment, irrespective of who you are, being tall, being short, black or white. Race discrimination shouldn't be, and physical appearance should also not be a barrier.
I can advise others to treat everybody equally so that we can we can be friends of each other.
My message of hope to the public is to understand the fact that disability is not inability, and we need to begin to have a mental shift, understanding that issues of disability is also human rights. We need to begin to change our behavior, our attitude towards persons with disability, understand the fact that they are also humans.
My message is you don't have to discriminate anyone to feel better. Everybody deserves to be loved. Everyone is going through a lot, so we just be kind to everyone.